Welcome to high-risk behavioral health conditions, complex encounters involving mental illness, substance use, and personality disorders, presented by the Colorado Behavioral Health Administration. In this 10-minute course, you'll deepen your understanding of behavioral health conditions that may increase the risk of aggression toward others, and explore strategies you can use to respond to situations with these individuals. After completing this course, you may have the opportunity to participate in a facilitator-led, problem-based learning activity that will help you apply the information covered during this brief learning event. This activity would be held back at your station or office and likely led by a department trainer or supervisor. Take a moment to review the course objectives listed here.
What are you doing here?
Sir, are you okay?
So, what should we do about this guy? On scene, you will encounter individuals with behavioral health conditions and those experiencing a behavioral health crisis. In some cases, the individual's symptoms or crisis, along with the social setting and context, may increase the risk of an encounter. Individuals with some behavioral health symptoms may be temporarily unaware of laws, rules, regulations, and social conventions. They may trespass, often unknowingly, or they may linger in public places, unaware of how much time has passed. They may display frantic behavior that alarms bystanders. It's also important to note that they may be unable to follow law enforcement commands, which can put them at significant risk. And last, they may be paranoid or have delusions about law enforcement or the government, which can cause them to panic or behave erratically. Ideally, these situations, such as the one previously shown, are resolved without using force. From a perspective of public safety, it's important to understand the nuances of how behavioral health conditions, including mental illness, may influence aggression. The first thing to know is that common mental illnesses, such as anxiety and depression, have little impact on aggressive behavior. In fact, individuals with all types of mental illness, including serious mental illness, are much more likely to be victims than to harm another person. Some individuals with mental illness, including serious mental illness, may be at risk of harming themselves. Please know that if they do become aggressive, they are more likely to harm themselves than they are to harm someone else. You may be familiar with the term serious mental illness, which we mentioned previously. This term does not refer to a specific diagnosis or group of diagnoses. The concept of SMI was originally defined by the National Institutes for Mental Health. National estimates indicate that approximately 5% of U.S. adults experience serious mental illness, SMI. However, this rate is not consistent across age groups. It is notably higher among younger adults compared with older ones. This disparity suggests that recovery from SMI is not only possible, but occurs frequently over time. The definition is based on diagnosis, disability, and duration. Diagnosis. The diagnosis must be a major affective, non-organic psychiatric disorder, or a disorder that may lead to a chronic disability. Affective means that the disorder affects the person's mood and emotional state and the way they think, feel, and go about their lives. Non-organic means that the disorder is not a neurological disorder, such as Alzheimer's disease, ALS, or cerebral palsy. The diagnoses of individuals with SMI often include those such as schizophrenia, bipolar disorder, or major depressive disorder, but can include severe forms of other disorders such as post-traumatic stress disorder or anxiety. Disability. The next criterion is disability, meaning the symptoms are so severe that they interfere with daily functioning. For example, making it difficult to keep a job or maintain housing, and requiring assistance with basic tasks, such as personal hygiene or managing finances. Duration. The last criteria is duration. To be considered SMI, the individual must have symptoms that have required multiple episodes of intensive psychiatric care or lengthy residential care. The duration of the actual course of SMI is often years, decades, or even lifelong. It is also important to be aware of personality disorders, which are defined as long-term patterns of behavior and inner experiences that differ significantly from what is expected. All personality disorders affect at least two of the following: a person's way of thinking about themselves and others, their way of responding emotionally, their way of relating to other people, and/or their way of controlling their behavior. There are 10 types of personality disorders, although the same person can be diagnosed with more than one personality disorder. Of these 10 types, 2 are linked to aggression. These are antisocial personality disorder and borderline personality disorder. Another key thing to know about personality disorders is that they are treatable. Several types of evidence-based therapies can provide significant improvement. Substance use is the most significant predictor of aggression among people with and without mental illness. In a recent meta-analysis, all of the examined categories of drug use disorders, including cannabis, hallucinogens, stimulants, opioids, and sedatives, were associated with an elevated risk of aggression. However, the risk of aggression decreases after treatment. Many risks of substance use are associated with intoxication. Symptoms that may increase the risk of aggression include lack of inhibition or loss of the ability to stop doing something they have an urge to do, resulting in increased impulsivity; paranoia, which can increase the likelihood of behaviors motivated by self-defense, and other irrational thoughts, which can contribute to fears and self-defense motivation; and impaired thinking, which can interfere with the ability to understand the consequences of one's actions. However, the risks of substance use can also occur during withdrawal. Depending on the substance and other factors, individuals may experience extreme irritability and mood swings, as well as restlessness, a feeling of desperation, particularly when withdrawing from stimulants and opioids, and which may accompany paranoia. And racing thoughts and other cognitive symptoms can make it hard to think clearly, and they often occur alongside additional psychological and physical symptoms. Individuals with SMI may have mood-related symptoms, psychotic symptoms, or both. Mood-related symptoms include anxiety, irritability, restlessness, and feeling sad or hopeless. Psychotic symptoms can include delusions, which are false beliefs and hallucinations, which means seeing, hearing, feeling, or smelling things that are not there. People with psychotic symptoms may also have disorganized speech, or disorganized or catatonic behavior, which may include lack of movement or holding an unusual body position for a long time. Some of these symptoms may make individuals with SMI more susceptible to factors that can influence aggression. Higher rates of aggression may be identified among people with SMI compared with the general population, particularly if their mental illness is untreated and/or they are also using substances or have certain personality disorders. It is critical to know that aggression from a person with SMI is almost always motivated by self-defense. The person believes they are in danger, even if that is not the case. That's why it is so important to respond to individuals with SMI in a non-threatening manner and emphasize their safety. Individuals who have severe mental illness, substance use disorder, and antisocial personality disorder at the same time are significantly more likely to engage in aggressive behavior than those with severe mental illness alone. Having a history of trauma and abuse, especially being the victim of violence and environmental factors, also contribute to the likelihood of perpetuating aggressive behavior. For example, individuals living in high-crime neighborhoods or those who are unemployed are more likely to be aggressive regardless of mental illness. But people with mental illness may be more likely to be in these situations. Most acts of aggression committed by individuals with mental illness are not directly caused by their condition, but are mainly driven by other factors. Although there is some connection between serious mental illness and aggression, the majority of people with SMI are not aggressive. There are 3 clinical symptoms that are associated with aggression that you should be aware of. They are command hallucinations or psychotic voices that tell a person to harm others. Sometimes a person thinks someone else, like an imposter or an evil force, is telling them what to do. But this isn't very common. Most of the time, the voices say harmless things, like what to wear or eat. Even if the voices say to do something extreme, people usually don't listen, especially if they're taking medication or don't strongly believe the voices are real. The second symptom linked to aggression is grandiosity, which includes delusions of power and mania. This can make a person feel overly important, reduce their empathy, and create a sense of entitlement to exploit or harm others. The third symptom is psychopathy, which is characterized by a lack of empathy, poor impulse control, and antisocial deviance. Psychopathy is not associated with mental illness or SMI, but rather with certain personality disorders, such as antisocial personality disorder. Be aware that these symptoms, especially in combination with substance use, can increase the risk of aggression. Some strategies that may be helpful for responding to a person in a behavioral health crisis include the following. First, slow down and give the person time to think and respond. This is key. People in a behavioral health crisis need time to be able to process what you're saying, and they may be frightened by sudden movements or rapid speech. Remain calm. If you show that you're nervous or angry, it's likely to escalate their crisis rather than de-escalate them. Understand that they may struggle to answer questions or follow directives because of difficulty processing what you're saying, or organizing their thoughts and behavior to respond accordingly. Be patient and give them time. Try to redirect the person if they're showing signs of psychosis. Don't argue with them or challenge any delusions or hallucinations they may be experiencing. Instead, try to redirect the conversation by just changing the subject if possible. Reassure them that they're okay, emphasizing that they're safe and you're there to help. Additional strategies that may be helpful include maintain calm, confident body language with an open body posture, slow movements, and don't fidget. If possible, try not to tower over someone. If they're sitting or lying down, try to kneel or sit near them if the situation is safe to do so. Give them space and, if possible, ask their permission or warn them before you approach them. Of course, always maintain situational awareness, such as noting the entry and exits available, objects that may be used as a weapon, and other people and animals in the vicinity. And last, maintain awareness of the individual's body language, including their eyes, hands, waist, and feet. Their eyes can indicate what they may be focusing on or thinking about, as well as their general mental state. Their hands can indicate their general state and possible intentions. In the unlikely event a person in a behavioral health crisis has a weapon, it may be stored on their person near their waist. Their feet and stance may indicate their inclination to run or take action. Crisis Intervention Teams (CIT) training teaches critical skills to assist first responders in de-escalating behavioral health crises. In conclusion, while common mental health conditions are not associated with aggression, those with serious mental illness, certain personality disorders, and/or substance use are more likely to have unpredictable, impulsive, or aggressive behaviors. 3 categories of clinical symptoms are associated with aggression in particular: command hallucinations, grandiosity and mania, and psychopathy. Materials are available to your team to help you explore situations involving people with behavioral health conditions you may encounter in your role as a first responder. Thank you for taking the time to learn about high-risk behavioral health conditions that you may encounter. Close this browser window to exit the course.